My name is Sinead Jones and I work for an organisation which combats lung disease worldwide, and it's called the Union. And we're interested in tobacco control because tobacco is the major cause of lung disease worldwide. The Union has a mission really of promoting lung health in the poorer countries of the world, in low and middle income countries. And it has experience of working in a lot of different types of lung disease: tuberculosis, and tuberculosis linked with HIV, with asthma, with child respiratory health. And one of the interesting things for me about tobacco, and the great challenges of tobacco, is that it cross-cuts all of these very serious lung health conditions. It exacerbates those conditions and worsens them. And so for us at the Union, tobacco is really a keystone of what we feel is important in our work, as well as, I think, a very important political challenge for us in the countries. There's a real appetite in the countries that we work in to take the same approach. This is our mission in this project.
Tobacco is the #1 cause of preventable death in the world. India is the #2 country as far as prevalence and rates of tobacco use, especially when you look at prevalence, projected prevalence, because it's growing in India, whereas it's decreasing in the Western world. Smoke-free Mumbai is very important in setting a precedence for the rest of India and the rest of Asia. Our objectives with smoke-free are to make all workplaces and public places, restaurants and bars, everything smoke-free by 2009.
Our governments listen better to evidence that is presented from a fellow Asian developing country, which right now we are doing informally and helping even without resources, but it could be multiplied and reinforced if there are resources put behind it. We met in a conference, and then India was legislating on package warnings. We needed support from Thailand. We approached the nurses network for tobacco control in Thailand.
Because Thailand has experience on the tobacco warning before.
They helped quickly, overnight, with a letter of support directed at our health minister.
For the tobacco control, in my belief, I think it's not a local issue, it's a global issue.
And I would think the Bloomberg Initiative has an excellent opportunity out there in terms of filling in some of those gaps and formally reinforcing regional collaboration between governments, between NGOs and research institutes in Asia and in other developing countries.
The Bloomberg Initiative is a new project which has started now at the beginning of 2007. It's an initiative that's working with the countries who have the most numbers of smokers worldwide, and it's funded by Mayor Bloomberg of New York with his personal foundation, the Bloomberg Family Foundation. It's really the first time that there's been a significant investment, money investment in international tobacco control. And for that reason, it's very exciting. This initiative will foster international exchange and relationships in a way that we will see things synergized and catalyzed. Things will start to grow much, much faster. We also have a wealth of information and evidence that shows us exactly what to do to solve the problem. And now we have an international convention, a treaty, where governments worldwide have actually stood up and said, we recognize tobacco as a problem, we know what to do, and we have the commitment to do that. And they have done this with the backing of organizations like ours, organizations from civil society that are working together with governments worldwide to solve this problem. So it's a very exciting time and a very promising time.